We get better each day through our commitment to learning creative solutions for improvement, using data to drive our work. For the Opioid Reduction Task Force, their continuous improvement efforts have changed practice patterns for the sake of patient health and safety. That's why the team is this year's recipient of the Values in Practice Award for Continuous Improvement.
The opioid steering team fits into the theme of continuous improvement in that the purpose of the project was to help improve how we as a system dealt with the opioid epidemic. This is actually a societal problem, and by tackling it as a system, we're tackling a broader societal problem and making a contribution to that, and hope it'll spread as well.
So one of our major roles with the team is to be able to take a look at some of the prescribing characteristics of our physicians or physicians in our community and try to identify which patients that may be at risk from some of that prescribing.
Looking at the data, it really led us to understand that there were certain regions in the service area that we had that maybe had a bigger problem with this than others did. So what it led the group to do was to go out, talk to the frontline providers in those areas to understand why.
One of the things that we tested first was how can we re-educate providers. A lot of the providers that are now being asked to manage pain across the healthcare system are not pain specialists. They are primary care providers that never received formal training on how to manage pain in the long term.
So one of the things the task force developed was a guidebook to help primary care physicians de-escalate their patients. The other thing is scripting on, if you have a patient you'd like to try to get off of opioids, how do you do that? And it's sometimes not intuitive for providers to do that. So the handbook helped.
One of the things that has made this project successful is the openness for our physicians across Bellin Health to go along with the task force on this journey.
I want to say thank you to the entire Opioid Reduction Task Force team.
I'd like to thank specifically Jody Wilmette, who is our Senior Vice President. She really helped bring this work forward. I'd also like to thank Dr. Casey for being an advocate for this team. I'd also like to thank the rest of the team members for their willingness to participate and really help bring forth the change. It was a group effort, and it's just a testament to how successful Bellin can be when we're all aligned.